Welcome everybody to this Contact NNPCF webinar. Before we start the webinar proper, I'm going to go through a little bit of housekeeping for you. So this is as I said, a Contact NNPCF webinar. Please bear with us. There may be technical hitches. We're broadcasting from two homes, and so if there are hitches, please be patient, and hopefully you can see this introductory slide. We are scheduled to go for an hour. We have a lot of attendees booked in for this webinar, so you'll all remain on mute through the webinar. However, you do have the ability to ask questions as we go. The questions will pop up on screen for me here, and I will try and answer as many as I can. I'm very happy to try and answer questions interactively, so please ask questions as we go, and I'll try and get to them at the most appropriate time in the webinar. So please do ask questions. If we run out of time and we have a lot of questions, we will try and make sure we get back to every one of you after the webinar. So at the end of the webinar, a short questionnaire will launch. Please take the time to complete this, as it really does help us develop future events. So with that, onto the substance of what we're doing today. So today's webinar is about the NHS long-term plan, and I should introduce myself. My name is Bruno Sisodia. I'm the East of England Steering Group member for the NNPCF and also one of the co-chairs. And probably more pertinently for today, I've been leading the piece of work with the NHS around the long-term plan on behalf of the NNPCF. So what are we going to cover today? So firstly, we're going to give you a little bit of background on what is the long-term plan. Secondly, we'll move on to drilling into the plan and telling you very specifically what it says about children and young people with SEND. What are the commitments that the long-term plan makes in this regard? Next up, we're going to talk a little bit about how the long-term plan is being implemented. So that's a national view. We'll talk about the regional view, and we'll also talk, very importantly for you as the audience, about the local view. What is being done in each locality? And then lastly, we will cover what should parent-carer forums do? What are the opportunities you have to get involved? And what are the sorts of things and questions that you should be asking of your local health partners? So that's a very brief overview of what we're going to cover today. So going through this webinar, there are two key documents that I'm going to keep referring to. They are on the left-hand side of your screen, the long-term plan itself, and you can see the link to the long-term plan there. What we will do is I'll reference, and through the webinar, you'll see that the actual slides contain references. And those are references to paragraphs in the long-term plan. So we're trying to equip you with the information and knowledge that you will need to go and have conversations with your local NHS leaders. So where you see a reference that starts LTP, that is a reference to the long-term plan. The second document we're going to refer to a lot is the long-term plan implementation framework, and that is prefixed by IF. So if you see a reference that starts with the letters IF, that's a reference to the long-term plan implementation framework. So what is the long-term plan? So the background is that in the summer of 2018, some of you will remember that that was the 70th anniversary of the NHS. And in July, the Prime Minister at that time, Theresa May, announced an extra 20 billion of funding for the NHS to be delivered between now and 2023. The pro quid quo for that was that she asked the NHS to develop a new 10-year plan for health provision. And this 10-year plan was to follow on from the 5-year forward view. Now, I might say a little bit about the 5-year forward view, which was the precursor to the long-term plan. This, very disappointingly, had very little indeed about children in it, let alone children with SEND. So when the NHS started to develop the new 10-year plan, we at the NMPCF were very, very keen, along with our partners across the sector, to make sure that children and children with SEND featured prominently in the plan. So the plan is based upon three realities about the NHS. This is the language that the plan uses. The first is great pride in the NHS, and I think that is reflected nationally, and we see that in all the polling and focus groups that the NHS does. Next was concern about funding, staff, increased inequalities and population pressure. So everybody recognises the NHS is under unprecedented pressure at the moment. And the third reality was optimism about the possibilities for the future with better outcomes. So that's the basis of what the long-term plan is built upon. And there are a number of key principles that the plan refers to. Those are shown here. So the first is that they want to boost out of hospital care. So the language they use is dissolve the divide between primary and community health services. So that is doing much, much more in the community. Secondly, they want to take the pressure off emergency health services. Obviously, that is linked to the first point there. The third key principle is they want to focus on more personalised care. Number 4 is around digitally enabling primary care and out-of-patient care. And number 5 is local NHS organisations increasingly focus on population health through integrated care systems. So that's an acronym. There are going to be a lot of acronyms, sadly, in this webinar, but that's one that will crop up a lot. The ICSs, the integrated care systems, and I'll say more about those later in the webinar. Now, what I'm going to try and do here is give you little pop-ups as we go. And the pop-ups are really a prompt for me and you as parent carer forums around things that you might want to go and ask your local area around. So the first couple of pop-ups here are, firstly, the focus of the long-term plan is overwhelmingly going to be around older people. That's sadly how a lot of the NHS thinks at the moment. One of our key roles is to make sure that children and young people aren't forgotten. The second pop-up there is around personalised care. And in theory, this is one of the key foundations of the SEND reforms. And so parent care reforms should know all about personalised care. And the key thing to remember here is that it's not just about NHS services. It should be personalised care across education, health and social care, and the NHS has got to fit in with that. So moving on to our second section, what does the long-term plan say about children and young people with SEND? So what I'm going to do here is actually take you through key elements of the long-term plan and tell you what it says, what the key deliverables are when it comes to our children. So the overarching principles of the children's element of the long-term plan are these 6 things here, and I'll rattle through them now. So the first is to put children, young people and their families at the centre of care. The second is to value our staff and take work on a multi-professional basis across boundaries. So again, very familiar to us. Thirdly, to draw upon the latest evidence and build upon the evidence base where it needs developing. Number 4, very importantly for us, is local systems are the agents for change enabled by national and regional support. So the plan is going to be delivered locally. Number 5, involve children, young people and families in the design and delivery of our work. So that is music to our ears as parent care reforms, because that's talking to co-production. And number 6, to target action at reducing health inequalities, including addressing the needs of vulnerable children and those with complex needs. Again, very good news for the work and the focus that parent care reforms have. So I'm going to start stepping through some of the key things that the plan now says that are relevant to children and young people with SEND. So the first one is and a long-term plan, paragraph 2.3, which is an extension of physical health checks to people with severe mental illnesses. Next up, there's more being done to ensure that people with learning disabilities and autism can lead happier, healthier, longer lives. So that's talking about timely support, proactive care in the community, reasonable adjustments, very importantly, so that the wider NHS can support, listen to, and help children and young people with learning disabilities and autism. A real focus on eyesight, hearing, and dental services, which are so often missed out for children with learning disabilities. Care in the community for those with complex needs, and accelerate the LEADER initiative. So the LEADER initiative, for those that you don't know, is looking at the avoidable deaths for people with learning disabilities in particular. There's a focus on continuing to identify and support carers, particularly from vulnerable communities, and continue to commission, partner, and champion with local charities, social enterprises, and KICs, providing services and support to vulnerable and at-risk groups. So parent-carer forms fall very, very firmly into that category. So some of the prompts from this section here, you might want to ask what's being done locally around all of these things and insist on co-producing it. Make sure that the focus on carers includes children, carers of children and young people, not just old people, which is where I suspect a lot of the focus is going to go. And that last bullet there is make sure that parent-carer forms are included in the commissioning and championing that's being done of local community groups. Next up, I'm going to talk about mental health services. What does the long-term plan say about children and young people's mental health services? So there's going to be increased funding for children and young people's mental health services. Expanded access to community-based mental health teams, including eating disorders, mental health crisis teams to prevent A&E and hospital admissions, school or college-based mental health support teams, and new services for children with complex needs in selected areas. So that's going to be rolled out in a pilot fashion, so not across the board yet. Moving on, we've got extending mental health crisis teams to prevent A&E and hospital admissions, extending services to cover 18 to 25 to support transition. So what are the things that we want to focus on here, or perhaps want to draw out here for parent-carer forums? So again, ask what is being done locally and insist that you co-produce all of this stuff. Next up here, when you're talking about school and college-based mental health support teams, that's an initiative that's being partnered with the Department for Education, and you can see the link there to go and find more information on that. And these slides, don't feel as if you had to write these links down now. These slides will be available on the Contact and NMPCF websites. And again, I think that last bullet there is really important, because the 18 to 25 provision really is a recognition that some of the basis of the Children and Families Act going from 0 to 25 is now being mirrored in parts of the NHS, which is great. So what does the long-term plan say about learning disability and autism, or both? So the abbreviation for that is LD+A. So it's working to address the causes of preventable deaths. So the two sorts of things, two key things there are improve the uptake of annual health checks. So any young person with a learning disability or autism is entitled to an annual health check with their GP. The target for that is 75% of people getting those checks, and a greater focus on avoiding over-medication and ensuring appropriate treatments for pediatrics, and that's the STOMP-STAMP program. So avoiding over-medication and appropriate medication. There's a big drive to improve the understanding of the needs of people with learning disabilities and autism. So greater training and awareness for staff, local systems, STPs and ICSs, and forgive me, I'll come back to what those acronyms are in a little while, will be responsible for ensuring reasonable adjustments are made, and a digital flag on patients' records to identify those with learning disabilities and autism. They want to reduce waiting times for specialist services, and we all know what a problem that is, particularly around learning disabilities and autism diagnosis. Working with social care schools and expert charities to develop packages of support for autism and neurodevelopmental disorders, including ADHD. And a really important one, a key worker support for children and young people with learning disabilities and autism complex needs by 2023. So an identified key worker for those with the most complex needs within the next 3 to 4 years. Next up, continue to move people out of inpatient care into community care and to promote personal health budgets, and the strengthening of CETRs, care, education and treatment reviews. Again, some pointers for you of what you might do as a local parent carer forum. So please go and ask your local CCG and your local system what they are doing around the monitoring of avoidable deaths and annual health checks. Again, there's some mirroring here of the principles of the Children and Families Act, with the idea that social care schools and expert charities are working with the NHS to develop cohesive wraparound care packages for some of our kids. And lastly, again, please make sure and go and have the conversations that all of this is co-produced. There are a few more bits and pieces of detail here that I want to add on that don't fit neatly into any one of the long-term plan work streams. So some of the things here are a rollout of clinical networks to improve the quality of care for children with long-term conditions such as asthma, epilepsy and diabetes. So these are going to be networks of hospitals and providers that work together in a joined up way to provide a more cohesive tier, tiers 1, 2, 3 and 4 service. So from the community level support to the intensive support that might be provided by specialist centres. Pediatric critical care networks and surgical services are going to be evolving to meet changing needs. And just a side note on that one, that is a piece of work that the NNPCF have been very heavily involved in, sitting on the clinical reference group for that review. And again, very importantly, selectively moving towards a 0 to 25 years service to improve children's experience of care outcomes and continuity of care in selected areas, for selected pieces of care. So again, some pointers for you. Here again, that 0 to 25 is music to our ears, because again, it mirrors some of the principles of the Children and Families Act and starts to bring some of NHS practice better in line with where children with SEND have been, in theory, going for some time. So I'm now going to talk a lot about how is the long-term plan actually being implemented. So what is the national, regional and local picture? So the principles here are that at a national level, essentially the strategy will be set. So at a national level, the leadership and direction of the long-term plan will be set. So this is really saying this is what the deliverables are going to be nationally. The regions are going to play a really, really big role. The regions are going to be responsible for overseeing the implementation and coordination of the plan. And in local areas is where the real hard delivery is going to happen. Local areas are going to be responsible for the design and delivery of the plan in each one of those local areas. And I'll talk a little bit more about what we mean by local in a little while. This is a slide from the NHS again that sort of reiterates what I just said, which is that there's going to be a national, regional and local focus here. Well, what does that translate like? So let's look at the national picture. What does that actually mean for the work that we are doing at the NNPCF? So a little bit on this for you. You'll see there's a little bit of color coding here, which is that the green boxes are the ones that where we as the NNPCF have representation. The grayish boxes are ones that we don't yet have representation, and yet being the important word, we're continuing to work to try and make sure that we get representation on these bodies. So at the top, the Children and Young People's Transformation Board is responsible for the implementation of the long-term plan as it relates to children and young people. Next to that Children and Young People's Transformation Board, and I should say that we at the NNPCF don't have a seat on that board. At the moment, no parental groups at all have a seat on that board. Children and Young People's group, Children and Young People do have some representation on that board, and that is simply because that the NHS has for some time had the mechanism to for representation by children, which I think is called their Youth Council. They do not have a similar mechanism to draw down representation from parents. They are looking into setting that up, and when they do, we at the NNPCF will be very heavily involved in that. But at the moment, no parental representation on that board, but likely to change over the coming months. Next to the Children and Young People's Transformation Board is a stakeholder council. So we do have very strong representation on this stakeholder council, and this is a group of essentially community groups, often large charities, including a number that represent children with disabilities. And we have a seat on that stakeholder council. The role of the stakeholder council is to oversee the work of the Children and Young People's Transformation Board and to really to hold it to account. So underneath the Children and Young People's Transformation Board, there are 10 work streams. Now, I think it's important to say that when the plan was first developed and published at this time last year, in January 2019, there were 9 work streams, not 10. And the missing one was SEND. Now, we and other members, our colleagues in the SEND sector, were up in arms about this, and we worked very, very hard explaining to senior managers in the NHS why that was a mistake and why they had to have an SEND workstream, because as many of you will agree, we cannot for a moment say that the NHS has fully delivered on the requirements of the Children and Families Act, and we felt that if the SEND were not explicitly represented as a workstream in the long-term plan, it would be forgotten. So after a lot of hard work and a lot of very stern letters and a lot of very difficult meetings with directors at the NHS England, we managed to get SEND added as a work stream. So that's the first thing you see there is underneath the Children and Young People's Transformation Board is an SEND work stream. There's also a learning disability and autism, or both, work stream. We also made the case here that it was a bit of a nonsense to have an SEND work stream and also a learning disability and autism work stream, because the two are really the same thing and they overlap. But the two work streams were not merged. We lost that conversation. There's also a mental health work stream, which we are very heavily interested in but don't yet have representation on, so we're going to continue to work on that. And then there are 7 other work streams, and I've listed them out there. So the regions, what's being done in the regions? So NHS England is divided into 7 regions compared to the 9 Department for Education regions that Parent Care Reforms and the Department for Education follows. These regions are a key driver for implementing the long-term plan, and a lot of the implementation and support for the implementation will be run out of the regions. And the regions have sizable budgets and discretion to set their own priorities and have money set aside to do this. So what are the key learnings for us? What should you be doing as Parent Care Reforms? Well, it's clear that you should be, through your NNPCF region, engaging with the NHS regional leads and regional plans. So please, please, please do work with your local NNPCF region to make sure your voice is heard regionally. Well, what does the local picture look like then? Moving on to that. So there are 100, as at April 2019, this is constantly moving. There are 121 sorry, 191 clinical commissioning groups in England. These are grouped into sustainability and transformation partnerships. These are STPs. So STPs are created to bring local healthcare leaders together to plan around long-term needs of their communities. The idea is that these are transforming into integrated care systems by April 2021. An integrated care system is essentially an SDP that has a closer collaboration with other CCGs in that area, but also links, and very importantly, links in elements from other providers such as social care and local councils. So the idea is that ICSs will be in place by 2021 and will join together healthcare services, some social care services, and some planning activities from local councils. At this point in time, at this very moment, STPs are drawing up plans to set out how they will implement the long-term plan. And this is why we felt this webinar was so important at this point in time, because those plans are being created now, and it's really, really critical that parent care reforms are involved in the creation of those plans and are working toward and working with their local areas to make sure that the voice of parent care reforms and the needs of young children, young people with SEND are met. So, things to ask of your local CCG is to ask, how is the setup of the ICS going? You will need to work with your neighbouring PCFs, because STPs and CCG and ICSs are groups of CCGs. And as I said, make sure that you as a parent carer forum are involved in creating these plans. So what is the footprint of the ICSs and STPs? Well, this picture here describes how CCGs are coming together to create these new ICSs and STPs. Please take a look at this and go and ask your local CCG which ICS/STP they are a part of and how their plans are developing. So, talking a little bit about the money that's available to the NHS to do this. There is a lot of additional money going into the system to support this work. So the local systems have already had their 5-year CCG allocations, and there's 2 ways in which additional funds are being made available. The first is a fair share basis. That's where the implementation of the long-term plan is expected to happen everywhere. And each system basically needs to be given a fair share of the money, a proportion of the money based upon population and based upon what the needs of that local population are. The other way in which money is being distributed is if the whole country is not being covered by a service or specific or a particular area has very specific needs. So some money is being delivered in a targeted way, and some areas will be piloting or leading the way on this. So questions for you to ask, please go and ask your local area what fair share funding and what targeted funding they are getting, and that will help you better understand the kind of work they're going to be doing. There are some very specific requirements in the implementation framework, in addition to those listed in the long-term plan around what they need to do. So firstly, around mental health, there's additional money for mental health, and there should be 100% coverage for mental health crisis services by 2023-24. There's the development of school and college-based mental health support teams is a requirement as well. There's going to be additional money pumped into for targeted investment to support the integration and improvement of children and young people services. And lastly, there's going to be specific things around learning disability and autism. So a named senior responsible officer to oversee the implementation of the long-term plan for learning disability and autism. Requirement to set out how proposals for learning disability autism align with plans for mental health, SEND, children's young people services, health and justice. Again, very important for parent care reforms. There's a requirement to set out the local offer for learning disabilities and autism, and that will hopefully be very familiar to that requirement, very familiar. And housing options and accommodation in the community. So some call outs there. Again, find out how all of these things are being implemented locally. I want to talk a little bit about something called provider collaboratives. So some mental health services and learning disability and autism services will be managed through provider collaboratives. These will be responsible for managing the budget and patient pathways for specialised mental health care for people who need it in their local area. So the idea is there's a recognition now from the NHS that it's unlikely that a single organisation will be able to meet a lot of the commissioning needs in a local area. And so they are encouraging providers to come together to form essentially consortiums to actually deliver the services that are needed in a more joined up way. Now, provider collaboratives are being rolled out at the moment, and there's a possibility that we're looking into a webinar on how those are going to be rolled out. They are very keen that parent care reforms are involved in that work, so please look out for those future webinars. Again, so find out how these are being implemented locally, and please get involved. Just a clarification, I've had a question come in, which is around the definition of learning disability and autism workstream, which is that just to clarify, it is learning disability and or autism, or both. So every time I say LDA, I mean learning disability and or autism, or both. Next up, opportunities are to work with, there are great opportunities to work with Healthwatch. So if you aren't already involved with your Healthwatch and you have the capacity, please reach out to them, because Healthwatches have the same footprint, have the same geographical footprint as parent care reforms, and they have a very similar remit, and that they have a remit to understand the needs of and experiences of local people and speak on their behalf. We have produced some material in conjunction with Contact and Healthwatch about how parent care reforms might want to work or can work with Healthwatch groups. You can find those resources at the link there. So please go and talk to your local Healthwatch, and together, I suspect you will have greater leverage around the implementation of the long-term plan in your area. Speaking with one voice. Co-production. I'm going to say a little bit about co-production here. So co-production is embedded in the long-term plan and the implementation framework. It talks about establishing local leadership, including working with local partners, young people, children, young people and their families. The learning disability and autism work stream talks explicitly about involving people with lived experience in their families and in checking the quality of care, support and treatment, and how reasonable adjustments are made. And the NHS patient and public voice policy explicitly talks to how patient and public voice partners should be engaged. This is a separate policy, but there are a couple of references in there. You'll see the link to the policy there. A couple of references in there that you might want to raise with your local leaders, NHS leaders, which is paragraph 6.1 and 8.1, which essentially makes provision for paying or reimbursing expenses and time where appropriate for the people that they partner with. So if you do not get any funding currently from your local health systems or your CCG, perhaps go and have a little chat with them about this policy and try to make sure that you are getting what you are entitled to as a parent care forum. So what should parent care reforms do? What are the learnings from this for parent care forums? And I want to leave you with essentially 7 thoughts. So please go and find out how long-term plan commitments are being delivered in your local system. engage with your STP and ICS to create the plan. Don't be shy and promote your expertise. Parent care reforms have got a lot of experience of implementation of reforms, most notably the SEND reforms. And also we've got a lot of experience when it comes to some of the key themes in the long-term plan, such as personalization, joint working, the 0 to 25 agenda. So blow your own trumpet. Understand the money. Ask the question about the money. How much fair allocation funding have you got? How much targeted funding have you got? Understand how the PPV policy might be used to help fund parent care reforms. Next up, make sure that the carers of children and young people, including siblings, are not forgotten. There's a huge focus on old people in the plan, and I have a suspicion that many local areas will look, when they see the word carer, they'll think about carers for old people rather than children and young people. Next up, partner with your NNPCF region and your neighbouring parent care reforms. You will need to, because the STPs and integrated care systems have a wider footprint than your local authority, and so you will need to work with your neighbouring PCFs and your neighbouring region. And lastly, just remind everyone that they must co-produce, co-produce, co-produce. We've just got to keep banging that drum and make sure that not only are children and young people not forgotten, that SEND is not forgotten, but the fact that co-production is not forgotten as well. So what's next? So we've got another webinar coming up on the 26th of February, where we're going to do a deep dive into the learning disability and or autism work stream. And that's going to be co-produced and co-presented by Mary Busk, who some of you will remember used to be on the NNPCS steering group as a London representative. She's now one of the public voice champions in the NHS, working for the learning disability and or autism work stream. And we're also working on a couple more webinars likely to be delivered in April onwards. One on provider collaboratives, on how you can engage with them locally, and one on the SEND work stream as to what's being done, the work that's being planned as part of the SEND work stream. So I think that concludes the webinar. Thank you for listening. I'm conscious that there was a lot of material there and a lot of information has been conveyed. Hopefully I've managed to do it in a way that makes sense. And I'll now leave the webinar open for a few moments to see if people have any comments or questions. Thank you. No, I've not had any more comments or questions come in. I'll wait a couple more minutes. But if we don't get anything, I should assume that everybody is has understood what we've said. But if you do have any further questions after this, then please don't hesitate to get in contact with us. No, that's lovely. With that, I think I'll close the webinar. Thank you everybody for attending, and the slides and the broadcast will be available on the contact and via the NNPCF website within a week or so. So thank you for joining, and hopefully that was useful to you. Goodbye.